is looking like. We are still sorting out the seats. But I'm so happy to see you all again, and I hope you liked the introduction and the opening. Now, our next chair for the two sessions are Miss, oh my, is it correct? It's Anton, right? Okay. You're the commodore. So Eugenia, whom you have met already earlier, and Elizabeth Bankston will be the two co-chairs of this session. And the floor is yours.
Thank you, Bettina. Thank you so much. Dear participants, colleagues and friends, it is my great pleasure to welcome you to this first plenary session of our annual meetings with the Regions for Health Network. It's a network I've been committed to for a long time and have been very inspired in my own work in a region in Sweden. So it's a great pleasure to see you all today. And I'm so sorry we can't meet in person because that is what we really would like to do. But let's try to make the best of all our technical equipment. So this first session, the scope of this session is to learn from past performance and to move forward into the future, and to learn how regions can further strengthen priorities for health. The present Regions for Health Network Terms of Reference was developed in 2015. And since then, the UN Agenda 2030 has been introduced globally, and new WHO European Programme of Work has been developed. And there has been 18 months of COVID-19 and pandemic restrictions, which have affected our way of working in many, many ways. The new European Programme of Work identifies Regions for Health Network as an initiative to be developed, as it is instrumental to support local living environments that enable health and well-being. Results from a recent interviews with the network members show that regions are very well placed and they have a strong mandate to act for change. And as we just heard, our region director Hans said, Regions for Health Network is on the cutting edge. The time has come now to revise the terms of reference and invigorate the members of the Regions for Health Network to reach our common goals. So the title of this session is Action for Health, What Can Regions Do? And we will have two keynote speakers who will outline where we are today. And that will be followed by a panel discussion on how to move forward. So let me see if I have my keynote, my co-chair, Dr. Evgenia Smutnikova, because if you are there, Evgenia, I would like for you to introduce now our keynote speakers. So over to you, Evgenia.
Yes, good afternoon, dear Elizabeth. I would like to welcome Bettina in Moscow. It is our first plenary session of the 26th meeting with Regions for Health Network, and the plenary session is called What Can Be Implemented by the Regions. And I would like to cite the Hans, and I was really hearing taking into account what we has done, and we see that all that regions do, it should be for well-being of citizens, and we need to take into account environmental friendliness and environment improvement should be implemented in our scientific national policies. I would like to welcome our keynote speakers who will provide their reports. This is Dr. Bettina Mana, Bettina, and core host is Mr. Andrew Charles. Bettina, I'll give the floor to you for the main report of our day session.
Thanks very much, Eugenia. For many of you, I will be, could you please put on the presentation? Please.
Несколько секунд, Беттина, сейчас все будет загружено.
A few seconds, please. It will be downloaded.
Yep. I mean, could you please put on the presentation? Please, technicians. Okay, it's coming. Yes, wonderful. Now I will be telling to move the slides ahead. So, I mean, we have heard already early this morning that the Regions for Health was created in 1992, and there are people in the room today connected who are part of this creation since 1992. In 2012, we had the Göteborg Manifesto, which actually delivered the sharing of the goals between us, the World Health Organization, and the Regions for Health. Then later on, we revised the terms of reference in 2015 to align with the Health 2020. Next slide, please. Next slide. Next slide. Yeah. Okay, as you could see, and we are currently working on a map which shows the NAT level so that we all see who actually is reflected and who is doing what. Currently, we have 34 regions confirmed, and we are still, we did a reconfirmation letter over the last few months, and we are still waiting for the earlier confirmed members to further join. We have also associated members, which are such as, for example, some Canada, I'm always saying it wrong, Saskatchewan, you correct me, right? Who is an associated member since many, many years and contributing from Canada. But we also have a few small countries which have also joined the network in form of an associated member. Next, please. So we are working on actually aligning and expanding the network. And as of terms of reference, we are really working together to advocate for the rights to health and the highest level of health and well-being. We try to inform each other. We are acting, you are acting as a bridge between the national commitments and the local and the regional commitments. We are trying all together to share information and leveraging opportunities. We would like to add, as earlier also discussed, regular reporting, and we will come back on this. Next, please. Now, each region, as we heard, has very, very different commitments and very different interests. But the most important actions which were taken over the last 10 years at least has been the Regions for Network has inspired the development of local action. Next, please. But also, of course, the international cooperation and other aspects. Next slide, please. And it has also enabled us to take, us as WHO, to take further action. And as we listened this morning, the strength of the network lies particularly in the environmental actions, which can be taken at the regional level, but also in actions related to the healthcare systems, the primary healthcare, and aspects of health equity, not to mention the many other strengths and experiences existing across the Regions for Health network members. Next, please. One of the aspects which surprised us very much is because I personally have been engaged in, I don't know how many hundreds of publications since I'm working in the World Health Organization. So I was thinking, you know, actually, maybe it's not the best to produce publications in, you know, at the, you know, in the Regions for Health, but what we learned from the survey done by Elizabeth is actually that it's not about publishing the work, but it's about working in the region together across various sectors to get this, the lessons learned known to everybody else. and to join a joint vision and joint objectives of collaboration. So it helps a lot to align within the regional government and within the regional institutions to move ahead. Next, please. And not only, also there is the other issue which has been mentioned so frequently of the added value as to come together in people, in person. So one of the things we tried to do since also with this meeting in Moscow, but because of COVID, we were not able to do this, is to have a face-to-face meeting. But instead of thinking about large meetings, we can think about specific working groups of small teams of people where we are actually coming together and work further in the future. Next slide, please. Getting therefore into the revisions of the terms of reference. Next slide, please. There are three issues. Agenda 2030 is at the heart of our developments. I mean, no doubt about it. It started, we are all engaged at the regional level, at the city level, at the national level, at the international level. But now we have COVID and we need to adapt also in terms of to the key priorities. Having said this one, I think our way is very clear. We will be adjusting, we will be incorporating our efforts towards the European program of work, specifically the objective of strengthening leadership on health and well-being across the government, across the regional government efforts, and work on the three directions, which are emergency response and recovery, which are health system strengthening, and the healthier population with a better climate and a better, if I may say so, environment as well as social dimension, and eventually take up a few of the flagship initiatives. Having said this one, next slide, please. Regions were asked what are the key priorities today, and in the survey done by Elizabeth, it health equity, environment, strengthen healthcare system, the health system were the top priorities. And this is so much reflected in the alignment with the European program of work. So how can we, World Health Organization, further support this? The next slide, please. As of what you want us to do as World Health Organization is really to share further our experiences, practices, methodologies were mentioned this morning, tools, and to provide a lot of political advocacy, getting your voice heard at the national, at the international level. And of course, supporting specifically each as much as possible regions on the needs you might have or you would like us to take. So therefore, I think we have a wonderful way ahead. At the end of this meeting, we will have a declaration of this meeting, which we will be discussing on Thursday afternoon prior to its launch. We will be sharing it with the members during these next couple of days for your endorsement. And we will be providing you with further input, possibilities of inputs into the revised terms of reference. Therefore, now I would like to hand over the floor to the next speaker, and we will have a lot of time to discuss all the issues which have been mentioned in this short presentation. And I thank very much Elizabeth Bankston, who was the co-writer of this presentation, and everybody of you who answered to the survey. Spasiba большое.
Thank you, Bettina. And thank you for the invitation to speak to you all today about our experience and action in Wales on how a future generations approach can strengthen the health in all policies and One Health agenda. And hopefully this will give a good example of best practice for other nations and regions to share. And we believe our experience and action in Wales can provide a blueprint for others who share the same ambition to leave behind a safe and healthy planet for future generations. So what can regions do? we're going to present our example in Wales that some of you may be familiar with, but hopefully give you an understanding of why and why we think it's more important now than ever before to think about health in a future generations perspective. So I will focus on how we have used legislation to drive forward a health in all policies approach to One Health and a future generations approach. And of course, as was mentioned previously, a lot of our work is set in the context of the Sustainable Development Goals, and health is a central part of sustainable development, not only in SDG 3, but also in how health affects a whole range of different goals under the SDGs. But in Wales, our journey around sustainable development started in 1998, where we were one of the first countries to have a duty to promote sustainable development. But as we developed our experience, working with partners, sharing our understanding with others across the world, it was evident that we needed to go further, faster, and be more ambitious in how we took forward a sustainable development agenda and integrating health, the economy, the environment, and society into what we do within Wales. So in 2015, we passed the Wellbeing of Future Generations Act by the Welsh Parliament, the Senedd Cymru, and it was recognised at the time that this was quite a different piece of legislation, a different approach to the Sustainable Development Agenda, and I'll spell out why that was. So one of the key parts of our approach in Wales was to translate the Sustainable Development Goal agenda from those 17 Sustainable Development Goals into 7 wellbeing goals for Wales. And the importance of translating United Nations and global aspirations at a domestic level is a really important part of how you gather ownership of an agenda. So we have 7 wellbeing goals that in many ways address the 4 dimensions of sustainable development, that is the economy, society and environment. But in Wales, we added in culture, because cultural well-being was an important part of Wales's expression as a nation, but also recognised by our politicians and our stakeholders as being an important part of people's life, people's well-being, and part of Wales's well-being. So in our legislation, we have descriptions of what those goals mean, and they are prosperous, resilient, healthier, more equal, cohesive communities, culture and language, and finally, being a globally responsible nation, recognising that what we do within Wales has a wider impact beyond our borders. But of course, whilst we have embedded a health in all policies approach through a Healthier Wales goal, there are important points to make here about the integration between health and prosperity and health and inequalities that are wedded into our legislation.
Excuse me, Andrew, excuse me for interrupting you.
Sorry.
But yes, the slides, we have just seen your first slide. Yeah.
Oh, right.
So is it possible for you to put it in a slide mode and move the slides while you're talking? Or
can you see that?
Yes, it's just the first slide yet. So if you have meant to move it forward, we haven't seen the other slides.
You haven't seen the other slide, right? I will do it in this mode then.
Yes, thank you so much. Sorry for interrupting you. Yeah.
No, thank you for interrupting.
This is much better. Thank you so much.
There we go. So I'll quickly go back through. So the context, as I mentioned, was around the Sustainable Development Goals on the importance of health within that, and our long-standing duty to promote sustainable development in what we've been doing. Then I sort of flagged up that we had passed the Wellbeing of Future Generations Act, and then I'll get into the specific goals. So as I said, we have a set of 7 wellbeing goals, which are on the screen in front of you. They translate those 17 Sustainable Development Goals into legislation within the Welsh context. And they were developed by the people of Wales. And they describe a set of outcomes for Wales in 2050 that cover a range of different aspects around well-being, the economy, the environment, society, and, as I said, culture. One of the ways in which we did that was to have a national conversation around the Wales we want, and asked the people of Wales what were the goals they wanted to see in 2050 that we would then secure into legislation. But under the legislation, we also have mechanisms to understand progress. So we have mechanisms to measure whether those 7 wellbeing goals are being achieved through a set of indicators, milestones, and we also have a legal duty every 5 years to produce a future trends report. And this is a mechanism to ensure that the long term is considered important in decision making by government and public bodies. And here's a sort of presentation on the range of indicators that we currently have that measure the achievement of those 7 wellbeing goals, and they cover aspects such as healthy life expectancy, healthy babies, footprint, people being in work, being satisfied where they live, loneliness and homelessness, as well as global issues such as greenhouse gas emissions and healthy ecosystems. And we are currently out for a consultation, public consultation, on whether we need to address gaps in this indicator set as a result of the COVID pandemic. So we've identified that there are some gaps in here that don't pick up the importance of digital connectivity, as well as sustainable and active transport, and the importance that travel has been in how we've responded to the COVID pandemic. And we'll be updating these indicators by the end of the year. Now, the legislation also placed legal duties on public administrations and public organisations, and that includes the government. It has a very similar duty to the other organisations. So we placed duties on our local authorities and public organisations, such as our capital city, Public Health Wales, our public health institution, as well as organisations that manage our national parks and our fire and rescue services, including our health authorities. And their duty is to contribute to those wellbeing goals in what they do. We also bring these bodies together at a local level so that they can prepare a local plan of action of how to address those goals at a local level. Now, one of the ways that the legislation is slightly different is it actually describes how we expect public bodies to work in a more sustainable way. And that identifies 5 key ways of working. And these are the ways of working which, if you look at it from a health in all policies perspective, it is these ways of working that will try to unpick some of the longer term solutions that we're trying to deliver. So the importance of collaboration, of working with partners to deliver shared solutions. The importance of involving people, not just in what you're going to do, but how you're going to do it. And the importance of prevention. It was mentioned earlier on today, the importance of preventing problems from starting, and how do we address the balance between addressing need as well as preventing those challenges from arranging. The next one is around integration, and then around long-term, the importance of long-term in what we do. The other part of our legislation also establishes an independent Future Generations Commissioner for Wales. And the general duty of the Commissioner is to promote sustainable development, to act as a guardian of the ability of future generations to meet their needs, and also to encourage public bodies to take greater account of the long-term impact of what they do. And that Commissioner is quite unique in the world, because it's set up as an independent commissioner looking at the future, but within the context of our wellbeing goals. So this framework that we've established, we hope can provide a blueprint for others to look at and adapt and take the good parts of our framework, because one of the important things that we have stressed in the past is that the way in which we developed our response to this, to how we developed our response to the Sustainable Development and Health Agenda was in part from our engagement over the last 20 years in developing a sustainable development approach. But it's also important to recognise that last month, the United Nations, the Secretary General put out a document called Our Common Agenda. And within that document, it made a number of commitments about bringing forward a future generations approach within the UN action around sustainable development. So there's a commitment to establish a special envoy for future generations, to build in futures into the UN work, as well as establish a Futures Lab and Futures Report. And we're very pleased that that report recognised that many nations across the world had been establishing mechanisms around the future generations approach, and we're very pleased that Wales is one of those that has led that path. So what does it mean in terms of health? The work with the World Health Organization has identified that our approach in embedding a health in all policies approach, addressing health inequalities, is an important aspect of what we've been doing. Now, what we have been doing in Wales, of course, has been developing our Healthier Wales plan for health and social care, which is about balancing the need between health and well-being and prevention and hospital-based care and treatment. And our work has been framed under the Wellbeing of Future Generations Act agenda. Other work that we've been doing with the World Health Organization and others has been develop a toolkit for organizations to make a step change for a sustainable planet, and how do you implement the United Nations Sustainable Development Goals within a health context within nations and regions. And I'll put the link of this in the chat. So as we're discussing today, the importance of partnerships and sharing best practice across regions across Europe. I know there are many of the regions represented here today that are also part of our network around regions for sustainable development, and the importance of partnership working where we share best practice as well as our experiences of taking forward the health in all policies agenda is an important part of how we in Wales have developed our legislation and are now developing and implementing that legislation going forward. So hopefully that's given you a quick run through of our approach and can stimulate discussion around what other regions can do and what they can learn from us and what we can learn from others. Thank you very much.
Thank you so much, Andrew. That was very interesting. And thank you, Bettina, for your presentation. We have now listened to two of our keynote speakers today, and I would like to also open the floor for other participants or other panelists maybe that want to make a comment or have a question to our two keynote speakers. I will do that before we go into our panel discussion. I'm trying to read the chat while we are having this session, but I can't see any comments yet. So if you have a comment, if you have a question, please put it in the chat, and then I will read it and see if we can have a conversation through the chat. But before we move forward and before I see any questions, I would just like to ask you, Andrew, a question that I was thinking about while you made your presentation. And that is, it is very impressive to listen to you. And I have listened to Wales before, and I have followed your Future Generation Act. And I've had this thought that to be able to do this and what you are doing, is it necessary to have a legislation? Because that is what we are sometimes discussing in other countries, in other regions, and definitely in Sweden we have been discussing this. Do we need a legislation or not? And quite a few people say, no, we don't. We already have the legislation we need. And someone else says, yes, we do, because we need to move forward. So in order to be able to do what you have done, do you believe it has been of vital importance for you to have a legislation? And that is also on your regional level, because most regions are not able to do a legislation on the regional level. They have to wait for the national level, but you have been able to do that. And how important is it, do you think?
So our experience of promoting sustainable development from 1998 to 2010 showed that whilst we were making some positive gains in the understanding of the link between social, environmental and cultural and economic, that there was a report done in 2010, 2011 that identified that some of those commitments weren't being progressed significantly enough for us to feel confident that sustainable development was becoming the central organising principle. So the decision by the incoming government was to legislate for sustainable development, because it was felt that to put these mechanisms on a statutory basis was considered particularly important. I'll give the example of the Future Generations Commissioner, because in the UK we had a Sustainable Development Commission, which was abolished in 2010, and it was the view of the Welsh Government at the time that they wanted to secure those institutional mechanisms in law to prevent them from being rolled back. So the mechanisms that we have in terms of the goals, the measurements, the commissioner, as well as those other mechanisms around preparing plans at the local level, are important in driving forward action. I think it is fair to say that in other situations there may be different mechanisms, and that's why, whilst we are promoting our approach, we have always said that our approach has been developed over time with the engagement with our sectors and partners, and that just lifting our example to others may not work. However, I would say that there are more countries who are adopting either the same approach that we have taken in legislation or in just policy, and part of that is just bringing together a wide range of policy aims under a single comprehensive framework.
Thank you, Andrew. Thank you very much. Yes, I do believe that having this common framework of some kind is the most important. And if you can't have a legislation, you might be able to have a policy or a development strategy or whatever. But having a common strategy and a common policy, that is one of the successes. Thank you very much for your presentation and for inspiring the rest of us. Let me see if I have any questions. I guess we need to move on because we have this panel debate now, and we might be able to save your questions until the end instead. So it's now my pleasure to introduce our panel discussion, where we will explore and discuss how regions will be able to keep health high on the political agenda. We have all endured so far 18 months of pandemic crisis and restrictions throughout Europe, which have affected our work and not only our work, but also our personal life, and has put focus in many aspects of the importance of supporting a healthy population. The speakers in the panel all have long-standing experience within the Regions for Health network, and most of them are part of our steering committee today. So let me just introduce you to see that you're all there before we start the discussion. So Mrs. Solveig Wallin, the Policy Coordinator of International Affairs, Agency for Care and Health from Flanders. Yes, hello Solveig, hi. Ms. Julia Winkler, from the EU Agenda Health Across, Directorate for Medicine and Nursing in Lower Austria. Hello, Julia. Yes, you are there. And Peter Besnek, Head Center of Health and Development in Murska Sobota in Slovenia. Can I see you? No, I can't see you at the moment. Are you there? Let's see. Yes, there you are. There you are. I have to change my screen a bit so I can see you all. Yes, there we are. And then we have Dr. Mariana Diakova, the Deputy Director of International Lead and International Health and lead of WHO Collaborating Centre at Public Health Wales. Hello, Mariana. Hello. And then we have Dr. Camilla Eilebekk, Professor of Norwegian University of Life Sciences. There we are. Hello, Camilla. And then we have Mr. Anton Kulbashevsky, Head of Department of Nature Management and Environmental Protection from the city of Moscow. And maybe you are in the room in Moscow. Yes, I think I can see you there. Hello, Anton. Welcome. Okay, so thank you all for joining today, and you will have about sort of 5 minutes for highlighting what are the successes of networking with the Regions for Health, and what have you learned and how would you like to take it forward into the future with our new challenges. So Solveig, can I start with you, please? You are the representative of Flanders, and you have been a network member for a rather long time and been very active. So I would like to ask you, from your position where you work, how can you keep health high on the political agenda? And from your recent experience, how would you like to take that forward into the Regions for Health? Please, Solveig.
Okay. Thank you very much, Elizabeth. It's a pleasure. It's a bit pity that we can't see each other real time in live, but okay, that's for next year, I hope, really. But yes, indeed. Now, when I was listening to what Andrew was telling, I think my comment would go along in the same line. When you asked the question beforehand already, I thought, okay, I need really to think about what the impact of the crisis and take there the message. And what you see, what we all seen, is that health and all policies is not so much as an approach or a word, it is reality. So it's basically, I feel also with my colleagues that there is the need of maintaining the health in all policies, the cooperation mechanisms to maintain that really in the future. But what we definitely will have is that since there is a lot going on now in the preparedness for future public health crisis, there will always be more health into other sectors, policy areas. I guess so. I hope so, at least. But what we've seen is that there has been new forms of cooperation to mitigate, to fight against this crisis that would never have been possible beforehand. And now I'm talking about, and Andrew, you explained, okay, we do have this wonderful legislation. It's brilliant. I've always been, an admirer of the Generation Act in Wales. So you have this, but you see as well that in a more spontaneous way, you get the people coming together from the different levels, be it from the national, regional, but also the local level, working together towards persons, people on the ground. And this is what we've seen, is that not only the local, from the regional level, we could shape and give the opportunities, but it's really the local level with the local authorities that have been working together with the regional level, that have been working together with organizations on the ground outside the health and the medical sector. And this is brilliant. That's really a momentum to keep up. And I'm sure that this kind of examples exists in every country, in every region. And you feel that, and this is also one of the elements that we will develop more in Flanders as a policy, is that we feel that we need to take this momentum to keep it up and maybe to change. It's not about vaccination, it's maybe about contact tracing anymore, that you need this kind of cooperation, but definitely you can move and use the same approach for health equity, for climate changes, and to really to reach the sustainable development goals. And that, I think, is very important, because for years we have been wondering how on earth can we bring all this together? But keeping up the momentum will, of course, be the hardest way. And we're not yet there, I guess, but it's a fine progress. Thank you.
Thank you very much, Sol, for sharing your experience of new kinds of cooperation that has been enforced now by the COVID, and for cooperation with local levels. Yes, thank you very much. That is interesting and important, very important. Thank you. Okay, Julia from Lower Austria. Lower Austria has been working a lot with cross-sector and cross-border collaboration, and which has been quite difficult during COVID times. So from your position, Julia, what would you say that is important now for you to keep health on the agenda and keep up the momentum? And what would you like to bring and take forward into the network in the future?
Yeah, good afternoon. It's a good question. I think I'd like to answer it same as the other speakers. Us as a regions, we were heavily challenged in COVID-19 times, and also here in Lower Austria, we're quite federal. We had to find quick solutions. We had to work together, but I think we were able to manage quite all right. For us, for our cross-border work, we're quite active as well. But of course, COVID showed us from one day to another when borders were closed, okay, actually, patient mobility, which was a reality beforehand, we were able to manage that, stopped. And it was a little bit hard for us to realize, like, actually, such a health crisis, we haven't thought about it beforehand, and now we have to. But we were able to do so. And actually, in these places or in these border areas where we had already corporations put in place, it worked quite well to talk to the other side, to the other regions, and to find solutions. The one thing was, okay, patients couldn't come anymore across the border for healthcare close to home. But the second thing was that also healthcare personnel, they couldn't come. I think it was for, I don't know, 2 or 3 months that our healthcare personnel, they all carried, their suitcases in their cars because they weren't sure, like, at the end of the day, if they could go back home. So it was quite tricky, but still we were able to manage because we had this communication in place, we had these connections, and yeah, it worked better. The crisis communication was better where we had corporations in place. General, for the last year, we can say we kept on working. That's also a message. You have to keep on working on your daily business because we care about cross-border healthcare. And we had, for example, projects in place where it was about digital healthcare, and that still worked, and we still could cooperate with our neighboring regions. And we also kept working because we were preparing a cross-border healthcare center just up the border, and we kept building it. And now we opened it 2 weeks ago, and this will happen because, of course, borders are open now. And yeah, we'll just try to keep on working and keep on realizing our ideas, and it works quite well. And that's also a point where you can keep actually health on the agenda, not only on our agenda, but also on the political one, because now we have the attention, we have this success, we have this milestone, this cross-border healthcare center, and it will also bring us further.
Thank you very much, Julia, for sharing your experience of how cross-border could work or not work during the pandemic, and the difficulties that you had, and how you actually had the cooperation beforehand, and that helped you in this crisis. Good, thank you. So now let's move on to Peter from Slovenia and from the region of Murska Sobota. Peter, you have for many years been able to host summer schools, and you have been an active member in that sense in the network. And so from your position and from where you are now, what kind of experience would you like to bring forward, and how would you like to try to keep health high on the agenda for the future?
Thank you, Elizabeth. Yes, the question is very, very interesting. As we watched from our perspective,
Peter, we hear you. I mean, you're very low on your speaker, so could you either put it up or talk a bit closer to the microphone, please? Thank you. Oh, much better. Thank you.
Okay. As I started, well, we watched with awe when we saw how fast and out of the necessity the cross collaboration was established between sectors and health and other sectors at the local governments, and also vertical collaborations were established very, very fast when the reaction to the pandemic came. And we saw that this is due to the necessity. It was much more efficient in forming and also in formalizing these cross-sectoral groups that were actually then fighting the pandemic and also the aftermath of the pandemic on the terrain. And, for me, I think that we should somehow study these pathways. We should study the positions, the functions, the people actually that enabled this very, very fast response to help people cope with the COVID, and then maybe link it to One Health approach, and in this way we can keep the health on the agenda in the future. So it really was much easier to establish cross-sectoral teams, either horizontal or vertical, which is actually also important. The other thing that was also very good to watch or to be a part of is the response, at least in our country, to somehow widen the social net, the state measures that prevented people slightly into poverty because of measures to fight COVID pandemic. So this is something that is quite different as we have been watching from the financial crisis in 2009 and on. So I think this is a valuable lesson that we can take to the future. So if we have measures that prevent people to earn or to attend their daily routine jobs, we should be really looking after them and let them be on their own. This was, I think, also very responsive in this pandemic and a valuable lesson.
Sorry, Peter. It's a little bit difficult to hear you. So you were talking about measures. Could you please repeat that?
I don't know where you lost me.
I lost you somewhere where you were talking about taking measures.
Yeah. Well, I liked the way that the states and regional governments responded on expanding the social net, people not letting people be on their own, losing their jobs. And I think this is a valuable lesson that we should take also in the future, if similar crisis will happen or in any other type of global crisis. So this is really important not to increase the health inequalities, because this crisis, any kind of, either it's economic, financial, or is it a health crisis, tends to hurt those most vulnerable and the most. So I think this is a kind of nonsense that we saw in different countries. I think it was a general approach most of the governments to take care of people, not to lose their economic income to be provided for is very good. And I would really take this to the future and take it as a good example.
Okay, thank you very much, Peter. I was sorry, I didn't hear everything very well. I don't know about the others. Did you hear Peter well? Oh, Camilla did. Okay, so if we have any questions for Peter, please, Camilla, you have to.
Elizabeth, just a note to, if you hear not well, switch off when you listen to the English speakers, switch off interpretation, then you hear much better. So that's a little bit of a trick you can use. Thanks.
Okay, I will do that immediately, because I'm sorry I didn't hear Peter clearly. But I heard that you thought it was very good with the fast collaboration that you experienced in the beginning, and that was something you wanted to study to take further, and because that collaboration was very helpful for you at the beginning of the crisis, and it was cross-sector collaboration, and that is something that you feel that we need if future crisis happens. Okay, thank you, Peter. And so now let's move on and to our next speaker, and I think that is Mariana from Wales. Of course, you have been working with the Future Generations Act, Mariana, and which we all are very envious of. But I also know that you have you're also a WHO collaborating center. So please, Mariana, what would you like to take forward, and what are your lessons learned throughout this pandemic? The floor is yours, or the microphone is yours, Mariana, please.
Thanks a lot, Elizabeth. I hope you hear me well, and please let me know if any issues. I've tried to pull together just a couple of slides, if that's all right, and I'll try to present them in a slideshow. Hopefully, they will be moving forward as let me see if I can minimize this. Is this all right?
It's okay. It's okay.
Okay, fab, great. So I realize obviously, and I have the privilege, of course, to share my experience and our experience with the working with the Regions for Health Network in Wales after, of course, Andrew Charles from Welsh Government. So, and necessarily, of course, we had the question that Wales might be a bit more autonomous, so to say, compared to other regions. However, I do feel that there is a lot which can be done in any region and every region. Doesn't matter at the level of autonomy, and I try to sort of summarize and just share some experiences as you've been asking around how we've been doing this. So of course what Andrew has shared is a combination of top-down and bottom-up approach, really. So of course the legislation is a very top-down approach which we are able to do in Wales. Of course, in other regions, this might be in the form of for example, regional or local strategy or policies or regulations in the areas, of course, of health, which potentially are autonomous. However, we've had, and we are still having a lot of the bottom-up approach, which Sol was mentioning around engaging with the public. So we had for developing the legislation and then implementing it through the Well-being of Future Generations Commissioner. We had a lot of a national conversation in Wales, a lot of cross-sector meetings and structure. For example, we have public service boards and other sort of structures on a regional or local level, which actually make this connection and put different sectors across around the table to try and make sure the decisions which are taken across different sectors are also good for people and for population health and well-being. The other two, which I would highlight, we've been doing is more like an inside out and outside in approach. So one would be related to creating a centers of excellence, you might call them, or as we have done with our WHO collaborating center. So WHO collaborating centers is one mechanism, of course, which local or regional level can support both on one side their own population and improve and work towards improving population health and well-being, but also support and work with WHO and translate, of course, this all of the new developments and also support in terms of innovating and developing and producing solutions, if you want, to different challenges and problems. And then helping both internally but also externally, sharing the experience with other regions and with WHO. And the other is more outside in, which is also related to the sustainable development agenda, is using levers and partnerships with WHO, for example, and being part of the RHN to enable and strengthen sort of regional agenda and action. So as an example, again, our WHO collaborating center, a few things, and colleagues have been discussing what has been particularly done around the COVID response, of course, and as other regions have mentioned, and colleagues, we have been continuously, our work obviously have continued, and also as part of the RHN. So before COVID, we've been again different mechanisms to sort of cross-fertilize, if you want, and on one side to bring international learning in, but also to share sort of good practice we have in Wales has been study visits, and I know quite regions have organized this. So we did organize a study visit in Wales a few years ago, which again there was a number of regions participated in this around the area of health equity and vulnerable groups and reducing inequalities. Hosting RHN meetings. This is another mechanism which was mentioned also by Elizabeth, and obviously now Moscow is hosting this particular meeting. But this is another, of course, way of strengthening the health agenda and the well-being agenda, and linking with WHO and the Sustainable Development also goals, and highlighting them on a regional level. We've been developing a number of publications with the RHN, webinars, particularly around COVID, and then, of course, keeping very closely with the information in the newsletter. So, particularly around COVID, there was a series of COVID-nars, which again shared what countries have been doing in terms of the response, and we've been part of this together with quite a few other, with all of the member regions, I would think. Also keeping in touch with the newsletter and sharing it across with our key stakeholders, and also we developed a stream of work around international horizon scanning, which was looking again what countries have been doing, and evidence emerging we had weekly reports, and a lot of this, of course, has been communicated also with the RHN network. In terms of the more sort of using the leverage of international development and WHO, the new program of work and developments. So we have been able to enable a memorandum of understanding, which was signed between Welsh Government and the WHO Regional Office for Europe. So this memorandum of understanding has been instrumental for us. We have been working around, obviously preparing it for a couple of years, but just before COVID, it was signed last year in November 2020. It has a specific focus on health equity and sustainable investment in health and well-being, while leaving no one behind. So this has been very important, and activities we do with the network, with the RHN, but also additional projects. For example, establishing health equity initiative in Wales has been part of delivering to this memorandum of understanding. So I'll be talking a bit more about that tomorrow at the parallel session, because again, we have quite a specific work around that has been focusing around COVID, but also it's going forward into the development a health equity solutions platform for Wales. So these are just a few examples, which hopefully gives some idea around how we have been working Wales with the network, and again using global and European sort of levers to strengthen our policies in Wales, but also sharing our experience.
Okay.
For being able to share.
Thank you, Mariana. As you say, we will be able to listen to you further on in this meeting tomorrow. Is it? I guess yes. Thank you, Mariana, for sharing your experience. Camilla, can I ask you what you are not really representing a region, you are representing the academia, the university, and close cooperation with the region of I guess Viken it's called, yes. So what would you say that you can do as a partner and to a region who wants to keep health high on the political agenda, and what are your experiences now from the recent times? So please, Camilla.
Thank you, Elizabeth. I hope you can hear me all right. Very nice to see everybody. Well, as you said, my position is within the university, and in my region, which is Viken in Norway, there is a very long tradition for the region and the regional universities to have a very close relationship, which I think is really important and a really important requisite in order to keep public health equity and social sustainability high on the political agenda. And I mean that goes before and after crisis, I guess. So picking up a little on what Solveig said, and also others about collaboration, from my perspective, from the academic position, engaging in partnerships, networks, and collaboration with regional government is fundamental to keep up the momentum on public health issues. Also, I think working together at the regional level is absolutely necessary, as many countries in Europe delegate their power and responsibility for public health to the regional and local level. And we all know that it's on the national level, in the regions, in local communities, that where people live, that health and well-being is created. And this is also why the Region for Health Network is an especially important arena, I think, for sharing know-how and to keep health and well-being on the political agenda for the regions. And I think universities and regional governments collaborating is really a win-win situation for everybody. In my experience, regional governments, they experience a need for and a political drive towards more evidence-based practice and policies. And they are therefore pushed to collaborate more with the academic environments. And at the same time, at the universities, we are pushed politically towards becoming more important actors in local governance and those processes. And I think that regional universities have local knowledge and might be a good position for adding more value into collaboration with the regional health professionals and policymakers. So we are pushed together, but most importantly, partnerships involving regional universities and regional governments would be necessary, I think, to address complex public health issues on a regional level. And they are necessary because they enable us to collectively achieve more than we could achieve individually at each institution. And in Viken region, as I said, we have already collaborated for a very long time. And the regional government have been a very important initiator of several long-term collaborations with the university and the regions. And the latest one now initiated after the pandemic is a public health hub in the region, where the regional government and the municipalities, all the municipalities, and also the academic environments can work together to provide flexible, efficient, and innovative solutions to target big problems and to ensure social sustainability. And of course, solutions, and especially innovative solutions, is something that the politicians really like. So this really helps them keeping health high on the political agenda, I think.
Thank you, Camilla. Thank you for your interesting thoughts of collaboration between regions and the universities. And I know you have done a study on this, how universities can collaborate, and I think that is a very important aspect of our collaboration. So thank you very much for sharing your thoughts from your position in Norway. I would now like to move on to one member of our host delegation, and I think is Mr. Anton Kulbashevsky. And if I'm right, you are in the meeting room in Moscow. And as a host, as a host of this meeting, I suspect you have had some expectations of the outcomes of this annual meeting. So, and maybe something that you would like to take forward, both in your own region, but also together with the other member regions in the network. So could you please share your thoughts about your expectations from this meeting? Thank you, Anton.
Thank you, Elizabeth. I would like to thank all the participants, the World Health Organization, because this session, it is held here. We are relatively young participants of this network from 2019. It was before COVID-19. And we did a lot. We have done a lot during these 9 years. We have lots of innovative changes. Today, Mr. Byrkov, he showed different numbers which characterize us. In our region, it is the main northeast city, so it is a global network in energy sector, in um, human sector, in scientific sector, and in financial sector. We talk at this Moscow agglomeration, and we have more than 20 million citizens. Our experience as a global region, it is very important for this network, for the RNC, because these global processes are launched and within a very short period of time we achieve results. These 10 years we have managed to improve air quality twice. We have new approaches. These are general numbers, but we don't want to talk about all the aspects. What was mentioned here, there is a cooperation between scientific society and the government. We talk about innovations, what we have achieved because we implemented a very digital technologies and we did it very fast in terms of energy saving, in terms of healthcare. So in this regard, I feel that we are interesting, we have gained experience and we are ready to share this. Here we have such hybrid formats, and I would like to thank Bettina that she came here, that she visited our city. I feel that she will share her expressions. I would like to wish you all successes, to have fruitful work. I would like to say that we are open for the collaboration and we are ready to share our experience. It can be applied in other regions of the world. And to wrap up, I would like to say that there is no ceiling without. So it gave us the opportunity to expand world presence in terms of air pollution, in terms of pandemic fight. It is what unites us. If we have our joint efforts, we can be more effective, and we need to react to each other. And now there is a demand for this exchange of experience. So let's move forward. We have good aspects, we had bad aspects, but we need to solve this problem which affects the whole world. Thank you.
Thank you very much, Anton. And I am happy to hear that even though you are not a long-standing member, but a member for a short time, you have much experience in collaboration and you have gained a lot of experience in cross-sector working. So, and now you're open for our collaboration and for sharing your expertise. So we're really looking forward to have you as a member and a close member in this network. Thank you. Can I please hand over to Evgenia and see if you have any comments on this?
Thank you, dear Elizabeth. I was listening carefully to all the speeches that we had today, and some things I wrote down, and what I feel is important to note. During the opening remarks, we mentioned that we talk about ecology, we talk about environment, climate change, human problems. And our city, we have a great task. Within 2 weeks, we need to prepare a climate plan. Today, we had regions with their representation, and they said what is the level that they work with. They don't understand how to solve the problems. They have this consecutive approach. And there were some general approaches. It was like an idea that they want to offer. And I would like to summarize, and I would like to share my opinion. when we talk about public health, environment, and climate, they are not separate issues. They should be interconnected. And it's all about economy, all the sectors of economy. So these spheres, they are part of these important areas. It is about people, about regional authorities at all levels. We can see that these are questions that affect all spheres vertically and in other way. So we need to prepare a special plan on all sectors of the economy and all the special spheres. And it is very important, and it's not obvious, but for me it's really interesting to look at the experience of these regions for health. We heard that Wales, they accepted the law on environmental friendliness. These are high level documents. And from these norms, they will need to prepare all the programs for all the sectors levels. I do like how it was taken by Sir Charles.
Членам всем сети те обязательные критерии, которые должны быть в документах такого уровня в целеполаганиях.
And actually, we extremely enjoy the presentation of Sir Andrew, and it paved the way for future development of legislation in other different areas, in other regions. So this is extremely important. I want to emphasize such issues as long-term vision and integration. Also, the experience of creating a special commission and a special commissioner on sustainable development and healthcare, that's a very interesting idea. Moving to Solveig Olen, the efficiency of activities of different authorities, local authorities, regional authorities, and we should analyze it and realize what issues are to be resolved by the civil society and what by the authorities of any level. Then, Mariana, a very curious idea. As regional authorities, we have the necessary mandate, and we are working with long-term visions and documents that will be adopted and implemented in the long run. So, an important issue here is that no one should be left behind. Everyone should take part in reaching our goals, in cooperating. No level of authorities must be left behind, and this can be considered as one of our tasks or terms of reference, even as the Regions for Health Network. Not only ideas did we hear out today, but also the best practices of different regions. The green spaces are important, and Anton Kulbachevsky and Petr Burykov's presentations talking about very specific measures that have been taken to promote the agenda efficiently. And the theoretical structure that is enshrined in the long-term vision on the one hand, and the hands-on approach, the real best practices that the regional representatives told us, the combination of these two factors going hand in hand is extremely important for our future development. And meanwhile, I'm just looking at the chat, and I would really appreciate it if the representatives of regions commented, maybe just a few words. And I also noted Julia's words, that her answer to the question wouldn't be different from the answers of any other speakers. That means that we all have a consolidated position, and that means something. So for the future agenda of our conference, we have already talked with Bettina about the communique, the final communique, and we want to talk about the implementation of innovations within our activities. So while we work tomorrow and after tomorrow, I would like just to emphasize such issues as innovations. But mind you, innovations may be not only technical or technological, but also organizational. For instance, when a city is implementing some initiatives and it takes responsibility for the success of such a project, it's engaging the whole community, the city dwellers, to decide together on such issues as green spaces, trees and bushes planting, and so on and so forth. And sometimes these organizational innovations are as important as technological innovations. Let me check the chat once again. I see a lot of thank yous here. Thanks to Solveig, Bettina. May I ask you just to briefly express your opinion on what we must plan for the forthcoming 3 days? What do we plan for the communique? And then I will have a few words as a final say.
Thanks very much, Eugenia. For me, the most important aspect over the next 2 days, so tomorrow and the day after tomorrow, is really to get very clear in the Regions for Health Network. What are we going to do next in COVID-19 response together? This can be innovative aspects. It can be based on the lessons learned. COVID will not go away in terms of the virus. Okay, so we need to learn to live with it in the best way possible, in the most organized way possible. So what can we do about it, and using the Regions for Health Network to be better prepared now and also for future emergencies? So that's one of the thinking, also in terms of innovation. What is it, the difference we can make as institutions? What's the difference we can make? How can we convince our citizens to not be reluctant to vaccination? Example, etc. So that's one of the issues. The second, I would like to get very clear out on the day 3 on what can we do to get climate action at all levels. And I'm talking here about mitigation, greenhouse gas reduction and adaptation, adapting our systems. We heard examples of green spaces and electricity and energy and housing, etc., etc. But what is it? What is next? What is it we can strengthen? And we can only strengthen together in terms of also innovation. And as Eugenia was saying, it's not all about money and technology, right? It's also about the way on how we work, where we can be innovative together. So that's for day 3. And on day 4, I would like to get the voice out of the Regions for Health of all of you present to talk with our partners. And these are partners in government, these are partners of other organizations. And I want the other organizations, I would like to see them, what are their best examples on partnership? And how can we engage to address our common goals? And then last but not least, this will be leading to adjusting, as I was saying, the terms of reference of the network. And I was thinking, listening to Camilla, because I'm also coming from science, in my background, and Eugenia is also physical scientist. And so we have good science background too, that we also would like to to promote more the scientific aspects of within the network. Okay, so like could be an advisory group of scientists, for example, or several collaborating centers, as Mariana was already pointing out, collaborating centers, you know, working together, etc. But that's something we will need to think about it, how to get running. So, I mean, my goals are very near-term goals now. Okay, so what can we do together better? Yep. Okay, stop here.
Thank you, Gina, and thank you, Bettina, for clarifying the outcome of this meeting and what we would like to see, what is next. And as you say, it's not only money and technology, it's much more than that. And I can see from the chat, I mean, please do send comments or questions now, everyone, in the chat, because we have a few more minutes, so we can be able to discuss what the questions or comments. But I have a comment now from Solveig. You commented on what Evgenia said, and because you have all mentioned cooperation, collaboration. That is what you want to take forward. You have all had good experience from this crisis, that you have been able to collaborate. You have used the networks, you have used the collaboration you have had before, and you have been able to strengthen them during this crisis. And you would like to take that with you into the future. But how can we do that? How can we keep them? How can we have much more kind of collaboration? Because you have mentioned cross-sector, you have mentioned cross-border, you have mentioned cross-organizations, you have mentioned collaboration with the public. But how can we keep that kind of collaboration? And Solveig asks and says, what skills do we need to become drivers for that kind of cooperation? So Solveig, could you please elaborate about what you were thinking?
Thank you, Elizabeth. It's definitely because Evgenia, you picked it already up, and it's also Peter who mentioned that he's also very much interested in how do you get people so far or there that they really will work together. But it means also that you have someone or something behind it, and the something can be a frame, but you still need people to be able to communicate the message. And this is what is triggering us a lot also. I think Wales, you were working also, probably you had ambassadors or something, but what kind of skills do you need really to move it, to drive it forward? And maybe also a little bit on what Bettina mentioned is what do you want from the network? And I still think that if before COVID, if we would have had a systematic gathering, let's say, a meeting on specific topics that affected us during the COVID and still now, it might have been easier for several of our policymakers, because we had all over the half 1 year and a half, we had questions about how is vaccination running the strategy in other countries, what are they doing, how is contact tracing, what kind of an app are they using? So many questions that actually, when you look at it now, we had to be reactive at the moment, and there was no reference. That's all. Thank you.
Thank you very much, Sol. Yes. Being able to communicate the message and the skills we need to do that. Yes, that is something for future innovation. And reading from the chat, I can say that Dr. Carla Lozano says it would be interesting to do a small group of professionals about different innovation topic by virtual Zoom, for example. So having a smaller group, starting this discussion about what are the skills is a way perhaps forward. We have now 5 minutes left for this session. So is there anyone else who would like to come forward with a comment or a question? I would like to hear or see that. Please let me know. Either you raise your hand if you're a panelist, or if you want to just put it in the chat and then we can read it. We will keep the chats after these sessions. We'll be able to read it. Camilla, you raised your hand, please.
Yeah, I think this is a very interesting discussion, and I think really, I mean, I have experience from collaboration between the university and the regional government and practice, but I think there are some common things when you are going to work cross-sectionally or across organizations, and I think both soft skills, you know, are very necessary. Soft skills like being able to talk the same language, respect each other, understand each other, but also political and economic incentives, I think, are good drivers. So I think it would be really nice to discuss this further, how and to share the region's knowledge about this, because I know that several regions within the network have established very good partnerships within their regions.
Thank you, Camilla. Yes, definitely. There are a lot of very good partnerships in this network between sectors and within sectors. So this is a way forward, maybe. It is. Thank you. So thank you to all panelists for your interesting discussion and for your input into the network. And I will leave the word now to Bettina.
Do you want to say that?
Elizabeth, you mentioned really important aspects. It was the question, what are the skills that our regions need to have so we are drivers of this cooperation? We need to have sustainable network. It should be efficiently regulated by the government. There should be regions who are confident in their practices, and when we have all these elements in place, so we can conduct an effective policy. And Elizabeth, as you told us, that we need to have policymakers also involved, and we need to have measures in place, and there should be priorities which guarantee the improvement of public health and improvements of well-being. And it's all about health and public health, and these measures should be making these changes. Elizabeth told you that this chat will be active. Our task is to summarize the answers. What are the policymakers that we want them to have? What it can be the joint work in the regions. So their productivity on the territories they are responsible to, that it will be effective. It will be part of our community. I would like to thank Elizabeth. I would like to thank Bettina. I would like to thank all members of the Regional for Health, those who have present together, and those who were listening to us and who answer their questions and share their ideas in the chat. I'm the co-moderator, and based on our schedule, I would like to say that this session is finalized. This session is over. This day, the Solemn Day, is finished, and we'll have 3 days ahead. And I hope that it will be effective. And I feel that we will enjoy this work while we will communicate with each other, even when we have such hybrid format. Thank you. Today's session is closed.